Hi and welcome back to 5 Minutes with Dr. Ray. So we're going to be starting a new topic and looking at the next chapter in terms of options that are available in dentistry today. And we're going to be concentrating on dental implants. So with every single tooth that's missing, obviously there's always going to be a story behind how the person got into the position they're in, whether it's the one tooth missing or multiple teeth that are missing. And every single one of those stories will have a fair few options available for them. In this particular case, we're going to be concentrating on generically missing teeth, and we're going to be talking about whether we've got one or more missing teeth. The options, if I just run quickly through them, are normally either a removable option, such as a traditional denture, which has varying types, a fixed option, such as a bridge, which utilises the two teeth either side to sort of hold the missing tooth in place, or finally, a dental implant, which is a titanium screw that's placed into the bone socket itself, and then a new tooth is placed in over the top of it. The idea behind titanium being used in the body is not new. It's used in multiple locations around the body, whether it's for knees, for joints, for lots of other things in the medical profession in general. So it makes a natural transition to be able to utilise that in the jawbone quite naturally and easily to replace whether it's one or more teeth. It's not always the case that a single implant would need to be used to replace a single tooth. Sometimes we can use one or more implants to replace multiple numbers of teeth in different locations, which is why it's usually person-specific and case-specific for every single case. We've got cases and examples over the next couple of weeks and months where we'll show you single placements, and we'll show you cases where we've utilised strategically placed implants to restore a much larger number of teeth as well. So how does it work? It's very much a surgical procedure. It would be used in indications where we've got lovely teeth everywhere else, where we've got no gum disease, we've got no smoking or very little smoking, which does affect it, and medical conditions that don't affect it, which are usually bone-related conditions. So all of those things are going to be the negating factors that would stop us from being able to consider implants on a long-term basis. Now, obviously, every single person's case is different, so it doesn't mean that there aren't options available, it just means there is a discussion to be had. Once we've determined the strength and the quality of the bone that we have, we can then get a proper image done of that particular area, which is normally done using something called a cone beam CT scan, which is a sectional scan of a particular region that allows us to be able to see the bone in 3D and plan it properly with our 3D imaging software. Once we've got all that information, we can then plan appropriately and see exactly what can and can't be done in that particular case. The reason implants are slightly different in dentistry is everything else revolves around just the mouth. It means that we can plan the things that we need to using just the teeth itself or very small minimal x-rays. When you start going deeper into bone dentistry, then it starts to get a bit more complicated and we need much more information, such as scans, such as other parts of the body. The things to look out for would usually be, we've got something called the ID nerve or the interdental nerve, which runs all the way down the side of the jaws, and that's really relevant because it supplies innervation to the tongue and the lips. So trying to avoid that is paramount and crucial to us. You'll still be able to move your tongue and lips. It's not going to affect the motor movements or the actual movements, but the sensations, the touch sensations, the feel sensations, those are the things that it will affect. So obviously, from our point of view, it is absolutely paramount that we find out exactly where all the vital structures are in the body before we proceed with anything. And that forms part of our intense planning at the start. With the top teeth especially, this same area but in the back, will have things like sinuses involved, and sometimes the sinuses are in very close proximity and will prevent us from being able to do simple procedures. So again, we need to know that information. We also need to make sure that your sinuses are healthy, which will obviously complicate things if they're not, and that will involve us having to gather even more information if that's the case. It doesn't mean that just because you have the occasional sinus problems or other things that rules things out completely. Like I said, it's a data gathering information procedure at the very start to be able to determine what we can and can't do. Once we've got all that information, we can then plan exactly what we need moving forward in terms of either replacing a single implant or multiples, and then we can present that information to you on an individual basis. The implants are then placed into the bone. The area is left to heal for about a couple of months, normally about 2 or 3 months. If we find that we've got a deficient amount of bone, or that they, classically, a tooth that's been missing for say 20 odd years, it means that your body has lost a significant amount of bone over time because it's not needed to have the bone then, and it's resorbed. So as a result of that, we need to find alternative ways of maybe bulking up the area to restore the bone in that particular region before we can place an implant there, or most of the time it can be done at the same time as placing the implant as well. That is a process called guided bone regeneration or bone augmentation. And what that means is that we are placing synthetic bone in the area, which will allow us to use that. And over a period of the next couple of years, our own body will start to replicate and replace some of that bone to give us the strength that we need. There's multiple types of synthetic bone that we can use. Some of it is bovine bone or cow bone. Some of it is not and derived from other areas. So again, that is a discussion we will have with you if that's relevant for your case. Once we've then got the implant actually placed inside, and once the area starts to heal over the top of it, we normally wouldn't restore that for another couple of months whilst the implant integrates, or we call it osseointegrates, with the actual jawbone underneath, and over a period of a couple of months. It will then fully harden and fuse with your bone, which then allows us to be able to place whatever we need to over the top of it afterwards. The final procedure is really straightforward and easy. It allows us to be able to place, whether it's a single crown, whether it's being used to replace a large gap, such as a bridge in that particular area, where we've got an implant either side, or whether we're using multiple implants in different locations to then construct an entire jaw to be placed over the top of it, which we call an implant retained bridge. We can have fixed types of bridges, or we can have removable dentures as options that click over the top, and we can use implants for that as well. The reason I mention that is it's quite common for somebody who's had missing teeth or even a denture for a very long period of time that's now become quite loose and requires a lot of denture glue, or requires or is very non-retentive. It doesn't hold in very well at all, stops you from being able to eat a number of different types of foods, and for us to then consider placing a couple of strategically placed implants, 2 as a minimum, which then allows your current denture to be able to click into there and requires no glue to be used, and just makes it a lot firmer and easier, and it gives us the support we need moving forward. So there are plenty of things to consider with implants. The typical costs of implants are usually, obviously not the cheapest in the world, but they are in the region of $2,500 to $3,500 based on individual need. Whether it's the one that we need or whether it's more than that, that will determine what your individual plan is going to be. We've got to also look at certain sites, and I'm save this for another episode because it's getting into real detailed territory of where to consider different locations. Some implants will not have to worry too much about the appearance of them if they're placed in the posterior or the back region of teeth, but if we're considering placing something at the front, we've got to take in factors to do with controlling the gum lines and making sure that everything looks as natural as possible, which is one of the trickiest parts of implant surgery to do. It's been a whistle-stop tour. I've gone through a number of things that we will delve into further information on, but a typical implant cycle can normally take 4 to 5 months from start to finish, sometimes less than that, for us to be able to successfully restore that particular area. And in the meantime, we can utilise a number of temporary options, so you've got a tooth in place whilst the healing process is all ongoing. And in terms of longevity, it's a question we get asked on a regular basis. How long does a dental implant last for? Dental implants typically last for at least 10 to 15 years. And even then, if they're looked after well and cared for and maintained by your dentist and by the hygienist and by your own home care, they can last for even longer than that. The implant itself, success rates are normally 95% and over, and that's in the majority of cases. And even if there is a genuine failure early on, it's something that can be replaced very, very quickly and easily at no additional cost. But on top of that, it's the crown that goes over the top, which will need regular maintenance and care, just like any normal tooth or any crown. If they're looked after well, the gum disease is minimised and managed well, and the bugs and the bacteria are controlled well, they can last a very, very long time indeed. Speak to you soon.